Hi everybody and welcome to my channel with BB. This video of mine is about urinary tract infection, that is known as UTI in short form. Earlier I posted a short video about UTI in which I presented an overview about UTI. Today I will talk about UTI in detail. So let's start the video. A urinary tract infection is an infection in any part of your urinary system. In your kidneys, ureters, bladder and urethra. Most infections involve the lower urinary tract, in the bladder and urethra. Women are at greater risk of developing a UTI than are men. Infection limited to your bladder can be painful and annoying. However, serious consequences can occur if a UTI spreads to your kidneys. When patients come to us, we typically treat urinary tract infections with antibiotics, but you can take steps to reduce your chances of getting a UTI in the first place. Now let me tell you the symptoms. Urinary tract infections do not always cause signs and symptoms, but when they do, they may include a strong persistent urge to urinate, a burning sensation when urinating, passing frequent small amounts of urine, urine that appears cloudy, urine that appears red, bright pink or cola colored, which is a sign of blood in the urine, strong smelling urine, pelvic pain in women, especially in the center of the pelvis and around the area of the pubic bone. UTIs may be overlooked or mistaken for other conditions in older adults. Now I'll tell you the types of urinary tract infection. Each type of UTI may result in more specific signs and symptoms depending upon which part of your urinary tract is infected. If kidneys are affected, this condition is known as pyelonephritis. And in acute cases of pyelonephritis, the typical signs and symptoms are upper back and side pain, pain in the flanks, high fever, shaking and chills, nausea, vomiting. And if the infection involves the bladder, this is known as cystitis. And usually the symptoms and signs are pelvic pressure, lower abdominal discomfort, frequent painful urination, blood in urine. If infection involves urethra, that is known as urethritis, then usually the symptoms are burning with urination and some discharge may also come. You should contact your doctor if you have signs and symptoms of UTI, which I have just told you. Now let me tell you the causes. Urinary tract infections typically occur when bacteria enter the urinary tract through the urethra and begin to multiply in the bladder. Although the urinary system is designed to keep out such microscopic invaders, these defenses sometimes fail. When that happens, bacteria may take hold and grow into a full-blown infection in the urinary tract. The most common UTIs occur mainly in women and affect the bladder and urethra. Now I'll tell you about infection of the bladder, which is known as cystitis. This type of UTI is usually caused by Escherichia coli, that is E. coli in short form, which is a type of bacteria commonly found in the gastrointestinal tract. However, sometimes other bacteria are also responsible. Sexual intercourse may lead to cystitis, but you do not have to be sexually active to develop it. All women are at risk of cystitis because of their anatomy, specifically the shorter distance from the urethra to the anus and the urethral opening to the bladder. Infection of the urethra, that is known as urethritis. This type of UTI can occur when gastrointestinal bacteria spread from the anus to the urethra. Also, because the female urethra is close to the vagina, sexually transmitted infections such as herpes, gonorrhea, chlamydia and mycoplasma can cause urethritis. Now I'll tell you the risk factor. Urinary tract infections are common in women and many women experience more than one infection during their lifetime. Risk factors specific to women for UTIs include female anatomy. A woman has a short urethra than a man does, which shortens the distance that bacteria must travel to reach the bladder. Sexual activity. Sexually active women tend to have more UTIs than do women who are not sexually active. Having a new sexual partner also increases your risk. Certain types of birth control. Women who use diaphragm for birth control may be at higher risk, as well as women who use spermicidal agents. Menopause. After menopause, a decline in circulating estrogen causes changes in urinary tract that makes you more vulnerable to infections. Other risk factors for UTIs include urinary tract abnormalities. Babies born with urinary tract abnormalities that do not allow urine to leave the body normally or cause urine to back up in the urethra have an increased risk of UTIs. Blockage in the urinary tract. Kidney stones or an enlarged prostate can trap urine in the bladder and increase the risk of UTIs. Suppressed immune system. Diabetes and other diseases that impair the immune system, which is the body's defense against germs, can increase the risk of UTIs. Catheter use. People who cannot urinate on their own and use a catheter, that is a tube, to urinate have an increased risk of UTIs. This may include people who are hospitalized, people with neurological problems that make it difficult to control their ability to urinate, and people who are paralyzed. A recent urinary procedure. Urinary surgery or an exam of your urinary tract that involves medical instruments can both increase your risk of developing a urinary tract infection. Now I'll tell you the complications. When treated promptly and properly, lower urinary tract infections can rarely lead to complications, but left untreated, a urinary tract infection can have serious consequences. Complications of UTI may include recurrent infections, especially in women who experience 2 or more UTIs in a 6-month period or 4 or more within a year. Permanent kidney damage from an acute or chronic kidney infection that is known as pyelonephritis due to an untreated UTI. Increased risk in pregnant women of delivering low birth weight or premature infants. Urethral narrowing, that is stricture in men from recurrent urethritis previously seen with gonococcal urethritis. Sepsis, which is a potentially life-threatening complication of an infection, especially if the infection works its way up your urinary tract to your kidneys. So these were the complications. Now I will tell you the prevention. You can take steps which I am going to tell you to reduce your risk of urinary tract infection. These steps are: you should drink plenty of liquids, especially water. Drinking water helps dilute your urine and ensures that you will urinate more frequently, allowing bacteria to be flushed from your urinary tract before an infection can begin. Drink cranberry juice. Although studies are not conclusive that cranberry juice prevents UTIs, it is likely not harmful. Wipe from front to back. Doing so after urinating and after a bowel movement helps prevent bacteria in the inner region from spreading to the vagina and urethra. Empty your bladder soon after intercourse. Also drink a full glass of water to help flush bacteria. Avoid potentially irritating feminine products. Using deodorant sprays or other feminine products such as douches or powders in the genital area can irritate the urethra. Also, you should change your birth control method. If you are using diaphragm or unlubricated or spermicide-treating condoms, they can all contribute to bacterial growth. So you can use an alternative method of birth control. Now I'll tell you about the diagnosis of urinary tract infections. When patients come to us, we take proper history and do physical examination, and we recommend some tests and procedures which are used to diagnose urinary tract infection. These tests include analyzing a urine sample. We may ask for a urine sample for lab analysis to look for white blood cells, red blood cells, or bacteria. To avoid potential contamination of the sample, you may be instructed to first wipe your genital area with an antiseptic pad and to collect the urine midstream. Growing urinary tract bacteria in a lab. Lab analysis of the urine is sometimes followed by a urine culture. This test tells your doctor what bacteria are causing your infection and which medications will be most effective. Creating images of your urinary tract. If you are having frequent infections that your doctor thinks may be caused by an abnormality in your urinary tract, you may have an ultrasound, a CT scan, or magnetic resonance imaging, that is MRI. Your doctor may also use a contrast dye to highlight structures in your urinary tract. Using a scope to see inside your bladder. If you have recurrent UTI, your doctor may perform a cystoscopy using a long thin tube with a lens that is known as cystoscope to see inside your urethra and bladder. The cystoscope is inserted in your urethra and passed through to your bladder. Now let me tell you the treatment. Antibiotics usually are the first line treatment for urinary tract infection. Which drugs are prescribed and for how long depend on your health condition and the type of bacteria found in your urine. Now I'll tell you treatment for a simple UTI. Drugs commonly recommended for simple UTIs include trimethoprim sulfamethoxazole combination that comes with the name of Bactrim or Septra. Another antibiotic is phosphomycin that comes with the name of Monurol. Nitrofurantoin can also be prescribed. That is also very commonly prescribed antibiotic for a simple urinary tract infection. Also, we may prescribe cephalexin and ceftriaxone. Okay. The group of antibiotic medicine known as fluoroquinolones such as ciprofloxacin, levofloxacin and some others is not commonly recommended for simple UTIs, as the risk of these medicines generally outweigh the benefits for treating uncomplicated UTIs. In some cases such as complicated UTI or kidney infection, your doctor might prescribe a fluoroquinolone medicine if there are no other treatment options. Other symptoms often symptoms clear up within a few days of treatment, but you may need to continue antibiotic for a week or more. Take the entire course of antibiotics as prescribed. For an uncomplicated UTI that occurs when you are otherwise healthy, your doctor may recommend a shorter course of treatment, such as taking an antibiotic for 1 to 3 days. But whether this short course of treatment is enough to treat your infection depends on your particular symptoms and medical history. Your doctor may also prescribe a pain medication, analgesic, that numbs your bladder and urethra to relieve burning while urinating, but pain usually is relieved soon after starting an antibiotic. If you have frequent UTIs, your doctor may make certain treatment recommendations, such as low-dose antibiotics initially for 6 months but sometimes longer, self-diagnosis and treatment if you stay in touch with your doctor, a single dose of antibiotic after sexual intercourse if your infections are related to sexual activity, vaginal estrogen therapy if you are post-menopausal. So these were the treatment for frequent UTIs. Okay. Now I'll tell you about some lifestyle and home remedies. Urinary tract infection can be painful, but you can take steps to ease your discomfort until antibiotics treat the infection. I'm going to give you some tips. First tip is that you should drink plenty of water. Water helps to dilute your urine and flush out bacteria. Second tip is avoid drinks that may irritate your bladder. Avoid coffee, alcohol and soft drinks containing citrus juices or caffeine until your infection has cleared. They can irritate your bladder and tend to aggravate your frequent or urgent need to urinate. Using a heating pad. Apply a warm but not hot heating pad to your abdomen to minimize bladder pressure or discomfort. Now I'll tell you something about alternative medicine. Many people drink cranberry juice to prevent UTIs. There is some indication that cranberry products in either juice or tablet form may have infection-fighting properties. Researchers continue to study the ability of cranberry juice to prevent UTIs, but results are not conclusive. If you enjoy drinking cranberry juice and feel it helps you prevent UTIs, there is little harm in it. For most people, drinking cranberry juice is safe, but some people report an upset stomach or diarrhea. However, do not drink cranberry juice if you are taking blood thinning medications such as warfarin. So this was my video about urinary tract infections. I hope you have enjoyed this video, and since this channel of mine is dedicated to help humanity across the world, so please do not forget to share this video to others so that other people can also get benefit. And also, if you have UTI or if you are suffering from any other illness, you can post a comment on this video, and if I get a time, I'll try to make a video about your illness, or if I do not find a time, then I will reply to your comment as soon as possible. Thanks for watching this video. See you in next video. Bye for now.